calls.
You'll eventually get the 20% back. That Silver Connect card is going to pay her co-payments. Remicade, I believe, is an injectable, and her hospitalization co-payments. And tell them to turn his Part B on. All right, that is the cue. Today is Wednesday, the 15th of August. This is Medicare and You. The guys in the studio always laugh like all of a sudden I come right down. I'm bouncing all over the place, and it's time to go on air and just relax. All right, so I am extremely lucky today, extremely lucky. I have the Office of the Healthcare Advocate, the actual Ombudsman, Victoria Veltris, on the phone. She goes by Vicky. She's on line 3, holding patiently. I'm going to do the Mattatuck Minute, but Victoria gets top billing here. I'm so psyched to have her. Vicky Veltris on line 3. And let's just open up the phone lines and let her talk. Vicky, how are you?
Doing great. How are you?
Good. You can also listen to us on WATR.com, or if you want, you can just talk. Can you hear us on the other line in the studio?
Me?
Yes.
Are you talking to me? Yes.
Yes, okay.
Oh, very clearly.
So I just have to commend you on your unbelievably hard work, your tireless, literally 7 days a week, because I see you on television when I'm enjoying a cold Bud Light on a Saturday afternoon after I cut the lawn. I turn on the TV, and there you are up on the Hill in Hartford fighting for some legislative bill. I know you're in the office at 7 o'clock because I get emails, and you're there until like late in the night. So just congratulations on all your success. You've done a phenomenal job with the Office of the Healthcare Advocate, and top-notch job with the community, the up in West Hartford with the Children's Community Hospital.
Oh, right. Yeah.
I know that you were tirelessly working on that with Anthem, so congratulations on winning that battle. I've had several clients call me and say, I was listening to you on the radio, and you were nice enough to have Maureen, your coworker and colleague, call in. And really, I have to hand it to the Office of the Healthcare Advocate. You truly won that battle. You reached out to Anthem. I'm sure you probably talked to Dave Fusco or someone and said, we need to get this signed. We need this contract. It's essential to the state of Connecticut. So congratulations on that.
Well, thank you very much, Michael. But I do have to say, I mean, our staff is wonderful here. We have a bunch of dedicated people
They're
who work
incredible.
here.
Diane West is great.
Yep. And all they do, all we do every day is come in and think, we're here to help people. That's the bottom line. We're here to assist people and do our best to help them get the medically necessary health care coverage that they're entitled to under their insurance policy. So we work all day to do that. So that situation with Anthem, unfortunately, is becoming more and more prevalent, these hospital disputes.
Oof, it's unbelievable.
With the insurance companies. So all I really am concerned about, the bottom line I'm concerned about, is that the patients don't lose access to care.
Right.
And that's what that whole dispute came down to for me, was making sure every consumer that called our phone number got the care they needed. So that's kind of what we spend our time doing. That's what we're here for. That's what we get paid to do, and we're glad to do it.
And you're good at it. You're friendly. You're caring. Everyone I send to you just seems a sense of like relief once they talk to you and your staff. They know you're going to take the time and do it right.
Yeah, we really pride ourselves on, having expert staff people here who know what the health plans cover, what they don't. We know public coverage. We know private coverage. We know self-insured plans, fully insured plans. So we really pride ourselves on having experts here to answer the questions. And if we can't answer a question, knowing where to get the answer to that question. Getting the person to the right person for an answer.
Well, it's, the response time is usually within 24 hours. I mean, everyone I always follow up because I want them to realize that you're extremely busy, so you can't just call them back in a half hour. So I said, be patient, call the office. You right now are helping a client of mine in Southbury that I dealt with. They're no names for HIPAA reasons, of course, but they have a heavy French accent.
Yes.
The gentleman retired, and the wife was told wrong information by Social Security up in Danbury. And again, no names. This is just a generic scenario. I already reached out to them before the radio show, and they said, yes, we've already been contacted by the Office of the Healthcare Advocate. I actually sometimes call you the Ombudsman's office. But, I mean, it's really nice to know, and my listeners are so reassured that there is someone fighting for them, not necessarily always having to get an attorney or always having to just hear no by the insurance companies.
Right, and that, the bottom line is, we tell people when they call here, you never take no for an answer.
Right. You do say that.
And I pretty much try to tell the community that with everything. You would, if this happened in any other scenario, you wouldn't just say, well, okay, the answer they gave me is right, and I'll just accept that. No, you of course you're going to want to know why you got the answer you did, and whether the answer you got was actually correct, and based on the right interpretation of your insurance policy, or even whether or not there might have been an error in the determination. So, in fact,
or we're finding in the coding, the way things are coded now.
Correct. Right. So all of those kinds of situations do come through our door every day.
Every day, 10 times a day. And
it is true. Oftentimes, look, the people at Social Security, very, very busy. I think generally speaking, people are very good. They know the advice they're giving is
they
generally
are outstanding.
correct.
Let me give my Waterbury office a plug. Mrs. Teeter, Teresa Teeter, and Maria Grice and Robin Lawler. They do such a phenomenal job. I love going to Waterbury. I used to originally go to New Haven, but it's just such a reliable office that's my destination now for anyone in the New Haven area.
Right, but there are situations, like in anything related to health care, a fact or a scenario that a particular person presents could be just one of those cases that doesn't fit the mold. Well, and needs a little more investigation, a little more working out.
It was the communication that got blurred. And they are extremely busy at these offices. And the answer was yes, because the credible coverage letter was with them. So, but the problem was the husband was actually retired, not actively at work. And you only get 63 days once you stop working. It's called an SEP, a special enrollment period.
Right.
So now they're stuck with a humongous penalty. I know you're going to fix it.
We are working on it. Maureen said to tell you.
Yeah, Maureen.
We are actively working on it. As you said, we have already contacted
you're just so reliable.
And,
all right, so talk to us about some of the great stuff you've been doing. I see on your website, by the way, which I did download, the Affordable Care Act. What does this mean to you? Really well done. It's got the OHA label on the upper left-hand corner. I'll put it up on the YouTube page so you can see it here.
Oh, that would be great.
Yeah,
actually, we really wanted something. The Affordable Care Act is I've read it. Not everybody has read it.
I have it. I have 2,000 pages done.
But we had to. We have to so we can educate people about their rights.
My name's on the building.
I know, right? Yes, your name is on the building. So we wanted to put something up that was somewhat easy to understand for consumers and kind of the top line information about what it means to people in terms of, what are the rights you're getting? For instance, getting your kids on a policy up to age 26.
Right.
Insurers not being allowed to rescind your insurance policy anymore unless they have really substantial proof that there was fraud involved. Having no more lifetime limits and annual limits on policies. There were two reasons to do that little kind of a Q&A type thing. One was obviously to educate people about what their rights are, but the second was to let people know where these rights are coming from. I think a lot of people may not have tied the issues around annual limits, lifetime limits, dependent coverage, closing the donut hole, assistance with prescription drugs for people on Medicare Part D. They may not have tied that to the Affordable Care Act. So one of the goals we did, where we had with putting up that informational sheet, was to clarify for people where those rights were coming from.
Right.
So that when people are out there talking about the Affordable Care Act, they know whether it's politicians, whether it's me, whether it's a community person or anything, they know where the rights they have under their insurance policies are actually coming from. So
which knowledge is power. That's what I keep telling people. This isn't Obama. This is Health and Human Services. This is CMS. These are agencies. Everyone keeps saying it's healthcare reform. Yes, it's Obamacare. But Obama didn't do all this. Victoria Veltris, Vicky Veltris on Saturday, every Saturday for the past 8 months has been doing this, working, getting the exchange and up. It's people. It's not just one person.
Right, that's right. It's people. And there's people from all political persuasions, all stakeholder interests.
Right.
You know, we all care about this very deeply. I mean, everybody in the state, I think, has a level of caring, whether it's, you know, you're an uninsured resident and you need health care coverage, or whether you have insurance but you're denied the care that you need. I mean, so really, these efforts are around making things better for everyone in the state and the country, for that matter. But for us, it's Connecticut that we're really focused on.
Which is our state. We have to care about our state.
Right, exactly.
You can't believe the applications now. Even if they're a smoker, if they've ever had, like, acne, you are getting a rate increase because everyone's planning for 2014. Yep. So they're all across the board. It's Anthem, Aetna, Connecticut, Solo, all the carriers. You send an application in, and now they are so scrubbing it because now the Medical Information Bureau, the MIB, all the records, electronic records, and they're open. So the carrier knows. Everyone just doesn't say no anymore on the application. They really are scrutinizing it, and they're giving rate increases, step-up ratings based on your health now.
That is correct.
Yeah.
So there's two things with what you just said. It's really important.
Please
I don't know
touch
how many
on that.
people actually even know about the MIB, the Medical Information Bureau.
Medical Information Bureau is...
Did you know that your medical information is kind of out there like a credit bureau rating?
Out there like a Google search almost. Exactly.
That's one of those things that this office has been for a few years trying to do something about, because it's a terrible... It could be used to really hurt people in terms of pricing. So the other thing that's happening is we're finding people who are saying, look, my insurance premiums are going up, and I want to try to get a different policy, even with my same carrier.
Right.
So I have carrier A, and you know what? The premiums for carrier A's policy have gone up by $100 a month for me. So you know what? I'm going to switch to a different policy with carrier A that I think has a lower premium and maybe a higher deductible.
Correct, you got it.
So when I do that, though, now what's happening is the carriers are looking at those applications as a new application. So what's happening is the person is being treated as a new applicant for purposes of this different policy that they think is going to be cheaper, but the medical information is now being pulled down, and they're being what's called rated up.
Right on.
So they're actually because of which doctors they've seen, what conditions they've had in the last year or so, they're being given a policy which they think might be less expensive, but actually the premium's turning out to be higher.
It's only less expensive on the initial quote because the quote engines, the search engines, don't allow us to put a rate increase on it.
That's
so
right.
when we give the client a quote, it's based on their height, weight, age, and sex, and it always comes back, almost never has come back that same quote anymore.
Right.
$187 quote for a healthy 25-year-old male, guaranteed is coming back $214 because he twisted his ankle in college or something. I mean, I can't believe it.
That's correct, and that's the thing, and unfortunately, people don't really know that. So I try to tell people, look, when you're shopping for insurance, if you have a current policy, you need to really, if you're using a broker, fine, make sure you ask all these questions of your broker, or when you call us, you ask us these questions about, is there a chance my premium's going to go up, even if I'm moving to a policy with a higher deductible, which means higher out-of-pocket costs.
Do you have do you have a couple more minutes for us?
Oh, sure.
Vicky, the phones are lit up. We can't control it. Hold on. Caller on line 2. Line 1's waiting for me, my minute. But we have Victoria Veltris, goes by Vicky. She's the Office of the Healthcare Advocate Ombudsman. We have her on line 3. So you are free to call in. We have a caller. Line 2. Michael Regan, Medicare and You. How are you?
Hello, Michael. How are you?
Good.
Listen, I got a question here. I had a 5-way bypass and open heart surgery, and what's happening with the Obama plan now, I understand that 83% of the physicians are leaving in the country. How is this affecting the medical Part A and Part B, the plans? Also, we're looking at 2 new hospitals here in Waterbury. A lot of the patients probably should be at some of these meetings so we can understand, are we going to be covered the way we've been covered? I've been covered in this city now for 74 years. Are we going to be covered under these new plans?
Go ahead, Vicki.
Okay, so
nice and slowly. We're seniors over here.
Very good question. I think it's important to be very clear to people what's really going on here with the changes in the Affordable Care Act.
Right.
Bottom line, the benefits under Medicare, under the Affordable Care Act, which some people refer to as Obamacare, are not changing. Okay?
Nice.
Your benefits will remain the same under the Affordable Care Act. What will be different is, well, there are a couple good things, obviously, that the donut hole will be closing, and you are now going to get preventive care screenings at no cost. Now, the way they do that is to save some money going forward by cutting down on fraud and abuse. Believe it or not, there is a lot of fraud and abuse in the Medicare system. We could save a lot of money by going after that fraud and abuse.
And if you see fraud, make sure you do something about it, please.
Exactly.
We just spent $140 million trying to fight fraud, and we only uncovered $40 million of it.
And there is a lot out there, unfortunately.
Vicki, we cannot stop the phone lines. Every line is lit up. All right, caller on line 2. Did you get your answer?
Hey, Mike, it's Ferris from Fairfield.
Yes.
And I was having mixed reactions.
All right, Ferris, go ahead. Quick question. You have Vicki Veltris on the phone.
Well, at first I thought I heard Vicki implying that this was good for people everywhere, and it's a disaster for people everywhere, for all people, when you understand what it is. And I guess my question is, shouldn't we all try to do what we can to make sure that this thing gets repealed by the Congress? And I wonder if Nick's mention of doctors quitting their practice because of what an heavy-handed regime this is not one of the major problems with it. And remember that Joseph Lieberman of Connecticut had the opportunity himself to keep this from coming out of committee, and he, being a former attorney general, should never be forgiven for giving us this Obamacare, because he could have stopped it himself. So let's hope it gets repealed, and let's hear about more of the bad stuff in those 2,500 pages. Thank you for having Vicki on.
Oh, she's incredible. And you know what? This is an open talk show. Not everyone has to have the opinion. The one thing I do like, Ferris, I've spoken to you several times, and you're unbelievably intelligent. The one thing I do like is lower cost, hopefully, and no pre-existing condition clauses. Everything else can go by the wayside. But my mom died of breast cancer, and if, God forbid, that's my situation, I need care. I can't just be declined because I have a pre-existing condition. So if we can get some of the things ironed out, at least it's a good start. All right. Talk to you next 2 weeks, Ferris. Have a great day.
So I would just say in response to Ferris, I respect, he's obviously more than entitled to his opinion.
Real intelligent guy.
I think there's a consensus that there are things in the Affordable Care Act that could use fixing. But I do think it's important to point out that the Affordable Care Act really is not, the delivery of insurance to people is through private insurance companies.
Right.
To the Affordable Care Act. It is not a government-run program.
And also, to my fellow brokers out there, not all of us are going to be out of a job.
Yes,
the exchanges are for the lower income subsidy people that are going to get a subsidy that can buy, just like Charter Oak. Right. There's exchanges out there now. There's e-health insurance. There is Progressive, Geico. So if you're a good agent, I would recommend getting a consulting license, which is certified insurance consultant. But it's this. Everyone keeps saying, well, we're going to be out of a job.
No, and I have to say, Michael, the other thing, too, is in terms of the exchange, which is, I know you've been talking about it, but just so the listeners know, is a mechanism by which people who are currently uninsured in Connecticut will hopefully be able to buy insurance from private plans. Bronze, silver, gold, and platinum. But the agents are very actively involved in our exchange in Connecticut. In fact, we have a committee that's specifically designed around brokers, agents, around navigators, to incorporate our broker and agent community into helping hook people up with insurance policies under the exchange. So
I'm actually going to try to register to be an exchange office in Waterbury where people literally can come and I'll have a kiosk.
No, it's great.
Yeah. All right, so we are going to put the Affordable Care Act with a link to the Office of the Healthcare Advocate on our YouTube page. Vicki, I'll make sure you get a full copy for compliance. We always send it to CMS first for compliance.
Great.
And I hope you have a great day. I sincerely appreciate your time. I know it's valuable, and I cannot thank you enough as a friend and colleague. I hope you have a great
Michael.
day. You're great to talk to.
Just let me know.
I really always reach out to you. You know that. So thank you for everything you do.
Okay, thank you, Michael.
Right.
Take care.
We're going to take a commercial break. I'm going to have Tom Smith take the second half of the hour. As soon as we get back from the commercial break, we're going to have our Matatuck Minute. And I think that was a good first half hour. Thanks for listening, Medicare and You.